So I am Dr. Udaya de Silva, consultant pediatrician. I am going to tell you about the structured approach to acute poisoning management in children. At the end of the lecture, you are supposed to understand the structured approach to the end with acute poisoning and understand the protocol for the treatment of the child with poisoning. Poisoning is a chemical exposure which can cause different levels of morbidity and even mortality. Right? There are different types of poisons. Even previous lecture, some of explained to you: natural toxins, synthetic substances, drugs, chemicals used in agriculture, household, and industries. So routes can be different in a skin surface contact, mucosal contact, ingestion, or injections. In structured approach, you have to do it at two levels. One is the initial primary assessment, which is unfocused. We concentrate on respiratory and circulatory parameters. You do assessment of respiration, assessment of circulation, and if it is affected, you have to resuscitate, and then you have to go for the focused secondary assessment, which is the poisoning management. So we are talking about the D today. So initial assessment, you have to do the history and examination. Usually it is a short history because we are handling acute poisoning. The time of poisoning, if you know about the poison, that's the details of poisoning. If you know has any idea about the suspect amount, then you have to have some idea about the amount. And then the examination is usual examination, the general examination, and the system assessment. Investigation, you have to do some hematological investigations, biochemical investigations, and ECG, and even chest X-ray sometimes. The structured approach I mentioned under the D is decontamination, elimination, and detoxification are the main specific management of poisoning. If there is no specific management, most of the poisons doesn't have specific management, then we have to go for the supportive care. Under specific management, the decontamination is the removal of poison before entering the circulation. Elimination is removal of the poison after entering the circulation. Detoxification is neutralized or deactivate the poison inside the body. Then decontamination, if we take decontamination, removal of the poison before entering the circulation. If it is a surface, we can do the surface irrigation or washing in the mucosa or skin. If it is a GI, gastrointestinal entering, that is enteral poison intoxication, we can consider gastric lavage. Emesis is not, vomiting is not induced, it is not recommended. We can consider gastric lavage, and we can give activated charcoal. Activated charcoal, single dose is considered as a decontamination technique. And even endoscopic removal is done in developed countries where endoscopy is accessible in emergency management setup. I am going to talk more about, as I mentioned, elimination is removal from circulation. There are indirect methods like multiple dose activated charcoal, diuresis techniques, and there are direct methods, dialysis and plasmapheresis. Detoxification is inactivation in the tissue, as I mentioned you. Those are the antidotes. Only few poisons antidotes are available. So gastric lavage, it is effective within 24 hours of poisoning, 2 hours of poisoning, but usually 1 hour. But if it is, sometimes we can go even before, beyond 1 hour. Some people do it as 2 hours. And airway protection should be ensured before gastric lavage. And left lateral head down position with a whiteboard tube, accurately confirm the position, and oral airway to prevent biting of the tube. and the saline 10 to 20 ml per kg, that is, or 5 ml per kg, 10 to 20 in 3 cycles can be done, and continue till the effluent is clear. However, this gastric lavage is very attractive management with regard to the patient, but has unproven efficacy, high complication rates, but socially very rewarding. So gastric lavage is not a very good method of decontamination, um, but still performed in Sri Lanka in some places. But in developed countries like USA, they have the gastric lavage is disappearing from the management protocols. Single activated charcoal is the best method of decontamination. It is giving activated charcoal within 2 hours of poisoning, except there are few exceptions where substances with delayed gastric emptying, we should not do we can increase the duration of gastric lavage duration, and the dose of charcoal is 1 gram per kg. We can give either drinking or via orogastric or nasogastric tube. Few poisons where the charcoal is not effective: iron, lithium, mercury, cyanide, and other heavy metals. You may have heard of if you take the multiple dose charcoal, as I mentioned earlier, it is not a decontamination method, because multiple activated charcoal, what happens is the poisons which secretes into the gut by enterohepatic circulation is being removed by multiple dose activated charcoal. So that is an elimination method. The single dose activated charcoal is a decontamination method. Multiple dose activated charcoal is a elimination method, where you remove the poison from the circulation. It's like dialysis. You are removing the poison secreting into the gut through enterohepatic circulation. There you do the dose of 1 to 2 grams per kg, drinking NG or a positive, repeating every 4 hours, may reduce the absorption of control release drugs and like the poisons like oleander seeds, and it is elimination method. The other methods of elimination are forced urinary alkalization, enuresis, saline diuresis, multiple dose activated charcoal I mentioned earlier, dialysis, and extracorporeal removal of drugs like hemodialysis and charcoal hemodialysis. Under the decontamination methods, where the deactivation of the poison inside the gut, uh, it happens in some situations. These are some of the recognized antidotes. So the use of antidotes will be discussed in the poison management stations. I have listed these things: heparin, protamine, iron desphorexamine, isoniazid pyridoxine, lead penicillamine, methyl methimoglobinemia methylengo, methanol ethanol, methotrexate folinic acid, narcotics like the opioids, naloxone, organophosphate atropine and pyridoxine, paracetamol and acetylcysteine, tricyclic antidepressant and alkalization, beta blockers, glucagon, benzodiazepine, flumazenil, calcium channel blockers, calcium chloride, copper penicillamine, carbon monoxide oxygen, chloroquine diazepam, chlorine naloxone, cyanide sodium thiosulfate, digoxin atropine and digimon, ethylene glucone ethanol, and fluoride. So this is some of the summary of the algorithm of this. It means if the patient comes with decontamination, if patient comes with poisoning, If you can consider within 1 hour, if they present, consider decontamination. Within 2 hours comes, you can consider elimination, charcoal. But if there is substance like gastric emptying, delayed gastric emptying drugs, go for, you can consider even gastric lavage sometimes. But elimination is the usual method after 2 hours. Within 2 hours comes. If they comes 1 hour, you can do the decontamination first, then go for elimination with charcoal. Detoxification, if available, you can consider. That is different in different poisonings. It's paracetamol, it is different. Narcotic is different. But earlier the better. Earlier the better if detoxification available. But most of the times, the poisons patients sometimes they come after 2 hours. In those situations, even the patient comes after coming to OPD, then emergency department, then they come to the ward, maybe after 1 or 2 hours. Then the only method you can available detoxification and supportive care. Detoxification is always not available. Then always consider supportive care, which means whatever the system failing, you have to support the failing system. If there's respiratory failure, you have to support respiration. If there is circulation failure, circulation, renal failure, renal support, liver support, hematological support. Like that, the supportive care is very important in management, in the management of acute poisoning. So the structured approach is very simple. You do the primary assessment, assess the respiration and circulation. If resuscitation needed, do the resuscitation. Then after ABC approach, then go for the D. The poison management comes under the D. The D is decontamination, elimination, detoxification, and supportive care. So uh, that is the structured management. So don't make it complicated. It is extremely simple poisoning management because a lot of people I have seen they make jargon in the management of acute poisoning. Acute poisoning steps are very simple. So follow this. I think that's the end. So remember this: A, B, C, D is D, E, D, and support you can. That's all. Right. Thank you.